to visit with you all about issues pertaining to programs and services and activities that are of special interest to the seniors in our community and their families and loved ones. Today we're going to talk about one particular aspect of a very big issue that is a large concern for anyone who is approaching their later years, and that's long-term care. Now, we're not going to talk about the whole topic of long-term care, but just one little portion of it. It's one that a lot of folks aren't familiar with, but it's actually the largest growing industry in America right now, and the folks that are employed there or work there, it's the largest employment need and a growing employment field in our nation right now, and that is personal in-home care. I happen to work for an agency that provides private duty personal care services to individuals here in our community. And I have with me today our care manager, Sheila Pier, and we're going to be talking about personal care services, in particular private duty services, but we'll talk about some of the other options as well. So welcome, Sheila. Thank you for coming in to visit with us.
Thank you for having me.
We're going to try, since we both work for the same agency, we're going to try to keep this from sounding like a commercial for our agency, and we both feel very passionately about that, so please forgive us. I'll say in the very beginning, there are other very well-qualified professional agencies in our area. There are professional individuals. There are Medicaid agencies, but ours happens to be an independent private duty agency, and that's the field that we're most familiar with. So we might tend to kind of bleed over into that a little bit. So Sheila, tell me a little bit about personal care services for seniors. What does that mean?
Well, personal care is just whatever someone might need a little extra help with in their home or wherever they live. They might need someone to go do weekly grocery shopping or cook some meals for them, transport them to doctor's appointments, or they might even need some personal care, hands-on personal care.
Okay. How would this differ from, say, things that friends or family might help them with?
Well, not much really. Our boss calls us rent-a-kid.
Rent-a-kid.
We kind of fill in those gaps when the family can't be there because, you know, we're non-medical, so we can only do private duty home care. So we can just do about anything that someone's family member or friend would do for them.
Okay, and private duty you mentioned. Explain to folks what that means. There are a lot of individuals who are unfamiliar with that term. What does that mean?
Well, it's anything really that's not medical.
Okay.
We can't do anything medical. So a private duty personal care would be assistance with a shower, maybe dressing, standby assistance. Maybe someone uses a walker and they have a hard time getting up and down or getting in or out of bed. Just to be there to steady them or whatever, any kind of hands-on personal care.
Okay, so the personal care really is the assistance for individuals who just need some help in maintaining their independence, their safety, to continue living in their home environment for as long as possible, as long as they make that choice to. The private duty aspect, I think, refers a little bit to the payment method. So you mentioned Medicare. We know that there are some Medicaid options for that. How is private duty different?
Well, it's private pay.
Okay.
It's not billed through Medicare. A doctor does not need to order it.
Okay.
A family member just calls us up and says, hey, we need a little bit of help.
So the referral process, you can be self-referred. Are there situations where someone in the medical profession might refer these types of services to an individual or their family?
Sure. If the doctor is aware of our service, and a lot of the doctors here are familiar with Grace Care, and they might recommend to their patient to call us and that we could help with medication reminders or something like that if it's needed.
Right. Discharge planners at hospitals too, I know are a good resource for individuals to go to talk about their options for in-home care. in a community like Enid, which is highly rural, agricultural, a lot of times our children move away, after they graduate from high school, and we're left kind of to age in place here without all of the family support system that we've had in the past. And so it becomes a big concern for family members, how are mom and dad doing? Who's going to help with mom and dad if I can't be there? So I know from personal experiences that agencies like Grace Care and others are not just concerned with helping the client, the senior themselves, but also those family members. Can you tell us a little bit, share maybe a couple of examples where personal care services have provided assistance or have been a help to the whole family unit?
Well, most of ours are. That's what they do. I mean, we provide peace of mind to the family members who have moved off to California or Florida or Texas, wherever, and they can't be here and they don't have loved ones in the area. So they will call us, and we might just go over to make sure that their loved one has gotten up in the morning and taken medication, just to get started for the day. And we might go back in the evening time to make sure that they take their bedtime meds and get to bed safely. All of our clients are somewhat like that with the family members. And, we keep in contact with them and let them know how they're doing, or
eyes and ears on the ground kind
sure.
of thing. Yeah. The individuals who are struggling with the decision, should mom and dad stay at home? Should they move to assisted living? Should they move across the country and live with me? What would you say to them about their options?
Well, I would let them know that we're available to help them in their home wherever they are, for as long as we think that it's safe for them to be there with minimal care. Some of them might not want to have us there 24/7, so we might come up with a shift that we're there for a couple of hours several times a day to make sure that they're safe in their home.
And who makes that determination? How does that work as far as who decides when you're going to come, how often you're going to come, and how long you're going to stay, and what you're going to do when you're there?
Well, it's kind of a team effort. We have an evaluation. We have a nurse, registered nurse, that comes out and does a complete assessment. She will develop a care plan, and according to what she comes up with, she might say that an individual needs to have 24-hour supervision, that she doesn't feel that they would be safe in their home. Okay. However, most of the time we can come up with a plan that works for the family through input from family members as well as the client and just the whole team to provide the best, safest living environment for them.
Great. Now, would you say that the majority of people tend to need that level of care when they call, or are there folks who can benefit from these type of services who maybe are healthy and independent for the most part? How would you address that?
Well, some of our clients are very healthy and independent. They just need a little bit extra. It might be that they can no longer drive for, a vision impairment or something. So we might just provide transportation for them.
Right.
Try
And
to get
that's
them to their doctor's appointments and grocery shopping and that kind of thing.
Okay. Address the topic of dementia. I know that is a huge concern for seniors, for their families as well. Is it possible that this could be something that could help some folks to be able to stay home even with a condition that they're struggling with like dementia?
Sure. Yeah, and that's what, we kind of take pride in. We want people to be able to stay in their homes as long as possible, as safe as possible. And, when our nurse does the assessment, we try to come up with a plan that, even with some of the symptoms of dementia, of the forgetfulness and things like that, to make that home safe. She does a home safety measure where she'll go through the home and make sure things are in order and safe. So we kind of try to put together a plan that can benefit that client.
Okay. Explain a little bit about, we've mentioned home health and hospice and a little bit about the differences there. And just to further clarify to those who may be watching who are struggling to differentiate between the three major types of home care services would be the Medicaid or Medicare home health that is kind of dictated by Medicare, and you have to have an order from a doctor and be homebound, and it's intermittent for a short period of time typically, and it can be renewed, but there are limitations there and guidelines. Then there is hospice, which folks are a little more familiar with maybe, that deals with quality of life and comfort at the end of life. And then personal care, home care services. Can there be an intermarriage between the three? If somebody is using, for instance, hospice or home health, can these type of services, the personal care services, also be available? And if so, how does that work?
Yes, most definitely. We work in coordination with home health agencies and with the local hospice agencies. We kind of develop a relationship with them whenever we get a new client and we know that they're on hospice care. As the care manager, I will contact the hospice agency and find the nurse manager, and we'll kind of discuss when they're going and when we're going to be going, and we just kind of work together with that.
Okay, so we're kind of a gap filler then. And again, that rent-a-kid type of situation where maybe the family members cannot be there during the times when hospice and home health aren't there, like you mentioned, and we would come in to fill in those gaps and provide those needed services. I'm sorry, I am blanking a little bit here. It's hard to go to the public's point of view who may not be as familiar with these services and know that these options are there. And I know you and I have both watched kind of the relief come over folks' faces when they realize that there is something out there that they can lean on for assistance in some of these hard situations when they're trying to help mom and dad. The focus then isn't just on the hands-on tasks, if I hear what you're saying correctly. It's on enhancing their dignity and their quality of life. Can you address that issue a little bit?
Well, you know, that's our vision, is we enhance the lives of those we serve. And you know, for someone just to be able to stay in their home and stay in their home comfortably, whether they're on hospice care or they have home health coming in, anything that we can do to help in that process to make them more comfortable and just to fill out their days in their home, as opposed to having to go to a facility.
And to decrease the distress and concern in their lives and their families' lives rather than contribute to it. Tell me a little bit about the caregivers. What makes the caregivers different in a personal care agency type setting than maybe somebody that you would hire typically independently, or somebody who is working for a facility, something like that? How would a personal care employee or caregiver be different or the same?
Well, our caregivers are all certified home health aides. If they're not, they're actually going through training to receive that certification. We do an extensive background check on all of our caregivers, driving records. We do monthly continuing education units, so they're continually being trained. We're licensed, insured, bonded. That's something that you might not have with a private caregiver. And then just the training. We do lots of hands-on, lots of teamwork. We're a really big team.
Great. And so if somebody were trying to consider, well, should I hire someone privately? Should I go with an agency? Those would be some of the differences, providing that safety net there. And I know, again, there are private caregivers who are very well trained. They're certified home health aides or long-term care aides. The employment taxes and things are all handled properly. But there are some benefits to going through an agency, or some differences like you just mentioned, and another would be absenteeism. Can you talk about that a little bit?
Yes, if one of our caregivers calls in and can't make it to her shift, we have a pool of caregivers to choose from to fill her spot. So, if you just had a personal private caregiver, you might not have that benefit.
Okay. And tell me about your job. What, as care manager, what is it that you do for the families, for the clients, for the caregivers to help ensure, like you mentioned, enhance their lives?
Well, I'm the point of contact for the family members through the office. They'll contact me with any concerns, any changes in the schedule, or any upcoming health events that I need to pass on to caregivers. I kind of coordinate the nursing assessments and the reassessments if there's a time when we need to go out and do another assessment. And just to be that person that the clients are really familiar with. I go out to the house for the evaluation, for the nursing assessment, and then I will go out often with the first caregiver to introduce them. I just try to form a really good bond with the families to let them know that, I'm going to be there to help them get this going.
Well, and I know from experience, I'll tattle on you a little bit here, but sometimes the assistance that you provide is a little bit more hands-on. Can you tell us about a few of the tasks that you have stepped in as a Rent-A-Kid and performed for individuals?
There's been a time or two, we've had a client that was distressed about the leaves building up in the front yard, and so I was able to put someone on the schedule to help, but I went along with them, and we worked together and got all the leaves raked up. And I do things like that a lot. I'll show up and work with some of the caregivers while they're working if there's something extra that they need help with. Just to kind of keep that bond and communication.
Tales of you bathing pets and going to the vet and different things like that.
We've done that a time or two.
Yeah. What are some things, are there any other things that you think it's important for seniors and their families, or individuals, professionals in the community who deal with seniors or their families, to know about personal care in-home services?
Well, I think, a lot of people don't know about it. Mm-hmm. They don't know that there's an option for that. And just to get it out there that this is a service that can be provided for them. Mm-hmm. Some of our clients, after we're there for a week or two, they're so happy to have someone, they'll say, I didn't know that there was such a service. Right. And so it's kind of nice to see that. Mm-hmm.
And finally, we haven't talked about payment. We've talked about that it's private pay, and we've talked about long-term care insurance. Is there a limit? Is there a set fee? How does that work? And I know we're just, again, talking about Grace Care, but it's pretty general across the industry. And so can you address that just a little bit?
Well, private duty is private pay, so we don't go through Medicare or anything. However, we do help folks who have long-term care insurance. We will help them to get that started if they need help filing with their agency. We'll provide the care notes that they need to be able to file with their insurance. The rates are from 1-hour rates to 24-hour rates. Right. We provide care 24 hours, 7 days a week. So we've got different rates for each.
So it is an hourly rate typically.
Yes.
And can they change that? So they've had an illness or an accident and they need a little more help, and then they want to change to a more on-call type of a situation. Is that?
Sure. And we have that happen quite often. We might start out going 3 days a week and end up going 7 days a week, or vice versa. Right. Either way.
Right. Well, we are running out of time. I appreciate you coming. It's very difficult to get all of the information out there in the time limits that we have, but our hope is that this has just kind of been a starting point in introducing those who may not be familiar with personal care services in-home care or private duty care to that concept, and just helping people to know what their options are. It is a big issue. It can be highly distressing, and there are some solutions. It may not be the best fit for everyone, but even at an agency like Grace Care, we have folks call in, explain their situations, and if we can't help or aren't a good fit, then there are lots of other agencies and options that might be. So just know that there are options available for you. If you have any other questions or concerns about senior-related services in Enid, or have one that you'd like to visit with about, give us a call, 237-6911.